Well, without any further delay, let me introduce our first session for this afternoon, AI in Action, Accelerating India's Digital Health Journey. Our speakers for the session are Dr. RS Sharma, CEO, National Health Authority, Ministry of Health and Family Welfare, Government of India. Dr. Sharma has deep interest in using technology for governance and has led a number of e-governance projects at both the national and the state level. He has been responsible for implementing a number of projects related to ICT infrastructure, process reengineering, and service delivery through the public-private partnership models. The session is chaired by Rostow Ravanan, Chairman and CEO, Alfahive Inc. He is the former CEO and Managing Director of Mindtree. Pleasure to have you both join us this afternoon. Over to you, Rostow.
Thank you, Justin. It's indeed a great pleasure and an honor for me to share the stage with a very, very illustrious, highly accomplished Dr. RS Sharma and bring his views on how technology can make an impact to the healthcare industry in India, to the citizens of India, who are struggling with many healthcare issues as part of this NASSCOM XperienceAI Summit. Dr. Sharma, great pleasure to be with you today. The first topic on which I wanted to get your thoughts was that the phase of digitization in India is progressing very, very rapidly. And you have been at the forefront of this for many years in many roles, and you have shaped this conversation and this implementation of technology initiatives in India, through many roles that you've played with the government over the last few years. And now you hold a very important charter as the CEO of the National Health Authority to drive digital healthcare for India. So maybe the opening question I had for you was, what are the learnings that you had from the past experiences in your career that you think will be relevant for this aspect of what you're doing now? And what is your vision to digitize healthcare services for the common man in India?
Well, thank you, Mr. Ravanan, for that a very generous introduction of yours. And I think it's an extremely important question. As you know, pandemic has really, shattered the world in some sense in the last 2 years, and these have been worst of the times. But from a digital perspective, these have been very, very exciting times. If I'm asked to, I'm allowed to look at only from digital use of digital technologies in various conversations, then I'll say this has been the only gleam of hope, ray of hope in that. So what has happened is that we have now become very comfortable in using digital technologies, video conferences and stuff like that. People are also making phone calls, video calls very frequently. We have a lot of people, poor people from Bihar coming to Delhi, and every day evening they talk to their families. So I think that has been one of the good aspect of it. And couple the fact that first of all we have an extremely high sort of data consumption in this country, very low data rate, about 800 million internet connections, 600 million smartphones, 1.2 billion connections. So I think connectivity is ubiquitous. So that is one of the foundation of any digital activity on top of it. And as you know, the Digital India program, which was launched in 2014, it talks about creating digital infrastructure as a utility to citizens. It talks about creating connected applications on top of that digital infrastructure. It talks about citizens empowerment. And during this journey, we have created a number of artifacts which are unique to this country. We have created digital identity, which is there with 1.3 billion people. We have created a payment system which is extremely, hassle-free, extremely instantaneous, and it's absolutely free. So that's and your last month we did 6 billion transactions on UPI. So all these things really are an essential prerequisite, so to say, for a very good digital system to proliferate in this country. And that is what is actually happening. And we, in the digital health mission, which the Honorable Prime Minister launched in September last year, we are going to have about 1 year or so. Now, this is actually basic overarching goal of this mission is to leverage technology for delivering affordable, ubiquitous, and quality healthcare. And that is the overall vision of our Honorable Prime Minister. And that is what we are all working for. Now, maybe I'll answer specific questions as to what have we done so far in digital mission and how does it really, improves the affordability, the quality and the access of the health service delivery.
Thank you, sir. Thank you, sir. Really, really insightful. The next question that I had, sir, was in an emerging economy like India, with the kind of social structure that we have, a small, high, very very rich section of the society, but a large middle class and also an equally large section of society at the lower income levels. Government inevitably has to play a very important role in healthcare services delivery, and digital healthcare ecosystems can play a big part to help the government reach healthcare services to all sections of society. So in that context, wanted to understand, sir, what are the top 2-3 priorities that you are carrying, and what role can private sector play to help the government in this very, very critical initiative?
No, I think that's also an extremely important and relevant question. One is that, as you are aware, majority or about 60% of the health services delivery or healthcare is being taken care of by the private sector in this country as of now. So I think any intervention which takes place or any kind of initiative which is taken by the government has to factor in the private sector. And that is what we are doing in Ayushman Bharat PMJY, as you know, the Pradhan Mantri Jan Arogya Yojana, where we provide insurance and assurance cover for 40% of the bottom of the pyramid, poor people, and that's about 50 crore people, 500 million, as they would say in the West, people. Each family gets a health cover of 500,000 rupees per year. So that's the assurance, and the whole purpose of that PMJY is to ensure that the catastrophic impact, the families don't feel the catastrophic impact of some serious disease, which if and when it happens, and people end up selling their land, selling their cattle, poor people, they really, the disease brings them down to the poverty, below the poverty line. So that should not happen. So one is that the public-private partnership is happening in this. We have 25,000 hospitals empaneled in the PMJY. And 50% of these hospitals are private sector hospitals. So every intervention is taking care of that aspect. Now on the digital mission, actually it is ultimately what is happening is that we have created a framework. That framework talks about sharing your health record, creating your digital health record, then finally using the teleconsultation for contacting the doctors, creating an interoperable framework, because interoperability is extremely, extremely important in this country. You can't build silo applications. They have to talk to each other. And these are the frameworks which we have created. And whatever we have created thus far in digital infrastructure is also the interoperable, scalable, speedy, frugal applications. And this ABDM building blocks are no exception to that rule. And that basically will again require the participation of all private sector hospitals, laboratories, clinics, doctors, everybody. And that is the architecture where private sector is very much a partner. In fact, we keep on interacting with the private sector, and I'm happy to say that whatever consultation papers we have brought out, private sector has been extremely on board, and we are getting full support from them. Obviously, this project, as I always say, is a little more difficult than Aadhaar. Because in Aadhaar, what was happening is there is a government which is basically willing to enroll people and provide them digital identities. There are people who are looking for identities because they do not have a verifiable digital identity. So these are only two stakeholders. In this space, there are multiple stakeholders. There are doctors, hospitals, clinics, nurses, and laboratories. Everybody is there. So I think all of them will have to start digitizing their system, and then and only then we can have a digital delivery of health services.
Thank you, sir. Thank you. Very, very useful insights. The next question, sir, for you was that When we talk about bringing a large section of country like India on a common platform, on a very critical mission like health, there will be many challenges inevitably. For example, interoperability of data, the differences in language in different parts of this country, the differing levels of digital literacy across a country like India. Given your experience when you must have faced similar challenges in the past, rolling out very large initiatives across a large complex country like India, I wanted to get your thoughts on how these kind of issues will be handled in the health sector that you're currently leading, so that ultimately I think all of us have the same objective of firstly inclusivity across the country. No citizen should be left out on an important topic like health. So how do we ensure inclusivity and manage all these complexities?
Thank you very much again for that wonderful question, because I think when one thinks of India, one is not confined to guys who are educated, literate, and who can operate computers and systems flawlessly. One has to think of an extremely diverse country where you have people whose functional literacy is also, they are illiterate people, they are highly qualified people, all kinds of people are there. India is the only country which has so many languages, 26 languages which are recognized by constitution, and hundreds of dialects. So I think when you think of, as I said in the beginning, interoperability, inclusion, these are some of the very, very fundamental words which we think in our mind. So I'll give you an example, a recent example which may be fresh in your memory, example of COVID. So COVID was designed in actually very short time. The Honorable Prime Minister launched the vaccination drive in this country on 16th of January 2021. And actually we started working on COVID just about a couple of weeks before that. And basically when we designed it to be based on open standards, open APIs. So the day we put out the application, we also published the APIs. We opened these APIs later so that hundreds of different applications could connect with COVID. That is the idea. It has to be multilingual. COVID is now in 16 languages, 16 scripts, 16 languages in some sense. So I think this is what is important. And what we are building is not building for English or for Hindi or for Tamil or for Kannada alone. We are building for everybody. Number one. Number two, there may be still people who may not even have a telephone. There may still be people who may have feature phones. And therefore, we have to build systems which are community systems where they can go to a community place. So all health and wellness centers today in the country have the teleconsultation facility, as you know. The Sanjeevani has now been rolled out to every health and wellness center. So there people can do. All common service centers are now providing digital services, and one of the digital services will be teleconsultation also.
Correct.
So the way what we have done is, because in India everybody does not own computer, everybody may not own the smartphone. Therefore, we have to create shared collective community systems. So starting from that place where you have people who do not have a smartphone to the people who have who are fluent and who can do this. We are building solution which is inclusive solution. That's very, very important. So that part we are taking care of. Similarly, that part we are taking care of by creating only frameworks. The people can build applications on top of it, and those applications can be in local languages. So for example, somebody in Karnataka can build application completely in Kannada, no problems. Still the system should work. Still the system should be done in such a manner that it is scalable, it works for the whole country. That's how it is being built. So I think all digital systems have to follow this law of inclusion in this country.
Understand. We can see that on the ground, sir, including the amount of training that ASHA workers, etc., have received, and the kind of equipment, etc., that they are being trained on. You're absolutely right. So the services have to reach the common man, because there will be a time that before the common man can empower themselves and prepare themselves so that they can avail these services. For a country like India, the services have to be brought to the common man. I completely understand where you're coming from, sir. The next question that I had was industry associations like NASSCOM are very keen to partner with government on this important initiative of making healthcare available to everybody at high quality, affordable prices, easy access, etc. And maybe the area where NASSCOM can play a good role is to drive innovation, to bring technology, to encourage startups, and so on and so forth there. And we're already seeing some benefit, like cancer detection, and many things are coming out from the technology angle, from the private sector angle, from the startup angle, that people like NASSCOM are wanting to contribute along with government. But the second dimension of this, to some extent, is to align the sectoral regulators as well. For example, you have the Indian Medical Council and other sort of stakeholders who also need to be equally, on the same wavelength. How do we go about doing that, sir? Otherwise, in other fields, you have seen that sometimes technology overshoots the regulatory framework, and that becomes a bottleneck before the service is, availed by the consumer. How do we avoid the same issue in this case as well?
No, I think you are very right that unless the regulatory systems are completely aligned with this vision, things will get stuck at some point in time. So number one, we have the National Medical Commission, which actually is sort of regulating the medical education and medical profession in this country in some sense. So they are completely aligned with this vision. That's number one. Similarly, we have other regulators also. They are also, we don't go we are not doing anything which is ahead of regulation or breaches any regulatory overarching principle. So that's something which should be very clearly understood, that we are not doing something which is beyond that part. Second, I think I am of the firm view that technology can solve many of India's hard problems, and technology as an enabler can actually make solutions pretty easy in many areas. So as I said, the teleconsultation will make healthcare accessible to remote areas, because people can, consult a doctor remotely, and you can. And nowadays you have such systems where you can even capture the diagnostic details of a person, through this, and then you can share the digital prescriptions, because India has developed what is called e-sign facility. So I think those building blocks are there, which are placed there. Now, there are two kinds of technology, interventions which can happen. One is the pure tech players who essentially build solutions and innovations on top of the framework which we have created. And we have deliberately not creating any solutions. And you'll be happy to know that there are as many as 800 integrators who are on the sandbox of ABDM. Sandbox of National Health Authority, which are creating beautiful solutions relating to the personal health records, relating to the the hospital management information systems, etc. So that's one sector, one part. And that is going on very well. I must say that almost every week 4 or 5 sort of solutions are exiting the sandbox by completing the solution and getting a certificate. And we are actually also now trying to incentivize many of these players, in the sense that if they certify, we can certify some of the solutions. We are also creating, bringing together the HMIS systems, hospital management information systems together, so that they can deliver these systems on a software as service model. It's like when you sign up for a Gmail account, you are able to do all your mail business. Similarly, when you sign up to an HMIS, which is on the cloud, you are able to kind of configure this whole thing and software as service. So your hospital's account is opened on that cloud, and you can do all things without owning a software. So that's another part which we are doing. Second is also the fact that there are new devices. Technology is actually simplifying diagnostics. It is actually finding out new ways of doing the various kinds of tests. So for example, recently I saw a machine which can actually, if you scan the oral cancer, they just have that scanning machine and can figure out as to where that, if there is any malignancy which is developing, where is it developing, and etc., etc. So I think those are also innovations which are taking place in the health space. and there are newer techniques of even treatment of operations, etc., etc. Those things are coming up, and they have to be also sort of brought together and also celebrated. I must say, our Indian startups are doing a wonderful job in this, and the Honorable Prime Minister has actually ignited that entire Startup India and Startup system. That actually we will leverage. So I think we will continue to work with the industry, continue to work with the associations like NASSCOM or other health-related technology associations, as also health-related associations to basically bring in more and more innovation and technologies into the sector.
Thank you, sir. I know somebody like you would be really, really pressed for time, but on behalf of NASSCOM and specifically this event, which is the AI Experience Summit, I just want a few minutes more of your time to ask one last question of you. We know that from the senior most levels at the government, there's a recognition that data, artificial intelligence are technologies that can make big solutions possible for India. However, some of the projects in India where AI was experimented somehow have not been able to go beyond the proof of concept stage. In your opinion, what do you think are the bottlenecks, and how do we remove those bottlenecks such that these technologies are able to achieve their full potential and solve the problem for the common man in India on very, very critical topics like healthcare?
You are very right that AI is going to play an extremely important role in healthcare, especially the diagnostics and other kinds of predictive, how things are developing, how those things are happening. So I think this is an extremely important area. Now, I think there are two ways. One is that because of the population and because of size, AI ultimately requires data to train itself.
Correct. Correct.
Basically, without data, AI is really just an algorithm.
Correct.
So essentially, for training and tuning of the algorithms, you require data. So what we are actually now planning is that specific solutions of the artificial intelligence solutions in the health sector, we will provide them a platform to host, and then people can use again software as service. So let me give you an example. Let's say there is an X-ray machine or there is an MRI, and there are now machines available which can actually this whole digital thing becomes a data, and then you can plug it in. So once you plug it in and give it to the AI solution which is hosted on the cloud, the AI can then come up with its own diagnostic or its own inferences.
Exactly.
And this can be used software as service. So I can say, all right, I'll give you 10 rupees, you give me your second opinion on this issue.
Correct.
So in this process, the solution is getting an additional data point, an additional record, which can further enrich its own underlying sort of data on which it can be trained. And also the people are getting solutions. People are getting resolutions of their problems. So I think this way we can create a model where AI solutions can benefit from the rich data and also can in turn benefit the patients or the other people who are seeking advice from these engines and these solutions. So that I think is one way where we can do that. We are also coming out with the policy as to how we will share the data as an anonymized data sharing on a massive scale can happen. And because PMJY processes 1 million claims per month.
Wow.
1 million claims per
month.
Wow.
Okay.
So about 35,000 claims per day is what 35,000 hospital admissions are taking place.
Correct. Correct.
And we have the entire data relating to their diagnostics. For example, when we pre-authorize a particular in patient, then we say, okay, give me his vital statistics. So you put up a blood report or you put up a urine sample report or whatever, X-ray, etc. So those records are available. Now those can actually, be put as in an anonymized manner, in a way that this can be shared and they can be the research community and the AI community can benefit from them, and then can in turn benefit the sector. So that's how I think we are working to bring in those solutions and how those solutions can benefit.
Wonderful. Thank you, sir. I know I've already taken too much of your time. Very, very happy to have had this opportunity to hear your thoughts on behalf of NASSCOM and the entire Indian tech industry. Thank you so much for all the wonderful work that you are doing. And please count on us as your partner in this very, very important mission that you're driving. Any way we can support you, please count on us. Thank you so much, sir.
Thank you very much. And I also want to wish NASSCOM AI Summit relating to AI accelerating India's digital health journey. It's a very topical issue which you have taken up, and I think I want to wish the best for this summit, and I'm sure the deliberations will benefit the digital health systems in this country. Thank you very much for having me on your summit.
Thank you, sir.
And Dr. Sharma for that brilliant session and for showing us the art of possible in healthcare with the help of AI.